In this pivotal module, we examine how daily lifestyle habits, including nutrition, hydration, sleep hygiene, stress management, and environmental exposure directly influence vocal function and longevity. Often overlooked, these factors create the internal ecosystem in which the voice either flourishes or deteriorates. Drawing from disciplines such as nutritional science, psychoneuroimmunology, sleep medicine, respiratory health, and performance psychology, this module brings a holistic, biopsychosocial perspective to the art and science of voice care. You will develop a deep understanding of how their dietary choices, circadian rhythms, mental health, and physical wellness routines either promote or impair their vocal capabilities. For vocal professionals who depend on their voices, singers, broadcasters, speakers, clergy, call center agents, actors, teachers, this module lays the foundation for building a sustainable vocal lifestyle, enhancing not just performance but total vocal resilience. Key learning objectives. By the end of this module, you will be able to identify key nutrients and dietary practices that support laryngeal and vocal health. Understand the impact of dehydration, caffeine, alcohol, and reflux on vocal performance. Assess the role of sleep and circadian rhythm in vocal recovery and hormonal balance. Recognize lifestyle risks, smoking, pollutants, allergies, and how to mitigate them. Build a customized lifestyle plan for optimal vocal function and endurance. Section 1. Nutrition and Vocal Health. 1.1. The larynx and nutritional physiology. The larynx, like every muscle and tissue in the human body, requires essential macro and micronutrients to remain healthy. The vocal folds themselves are avascular, meaning they rely on diffusion from surrounding blood-rich tissues to receive oxygen and nutrients, making systemic health especially critical. 1.2. Key nutrients for vocal health: water, essential for tissue hydration and thin mucus consistency across vocal folds. Vitamin A, maintains epithelial integrity, found in carrots, sweet potatoes, leafy greens. Vitamin C, antioxidant that boosts immunity and repairs tissue. Magnesium, prevents muscle cramps and supports neuromuscular relaxation. Zinc and selenium, assist in tissue repair and immune modulation. Omega-3, fatty acids, anti-inflammatory, supports nerve function and joint health. Iron, supports oxygen delivery to vocal muscles. B vitamins, especially B12, nerve health and energy metabolism. 1.3 Foods to avoid or moderate: caffeine, diuretic, may dehydrate vocal tissues if not offset with water. Dairy can cause thick mucus in some individuals, leading to throat clearing. Spicy foods may exacerbate acid reflux. Fried foods and processed sugars, pro-inflammatory and contribute to mucus buildup. Alcohol dehydrates mucosal surfaces and numbs vocal feedback. 1.4 Eating habits and timing: avoid eating 2 to 3 hours before bed to prevent reflux. Incorporate small, frequent meals to avoid bloating that may affect breath support. Use anti-reflux diets where applicable: low acid, low fat, alkaline. Section 2. Hydration and vocal performance. Water is the single most critical substance for vocal health. It keeps the mucosal covering of the vocal folds thin and slippery, enabling smooth, frictionless vibration. Systemic hydration comes from drinking water and eating water-rich fruits, cucumber, watermelon. Surface hydration, influenced by steam inhalation, humidifiers, and avoiding drying environments. Target intake: 2.5 to 3 liters per day for active vocal users. Avoid smoking, dries out mucosa, excessive air conditioning and heating, dehydrating medications, antihistamines, diuretics. Section 3. Sleep, recovery, and hormonal balance. 3.1. Sleep physiology and vocal restoration. Sleep is when the body repairs tissues, balances hormones, and restores vocal strength. Growth hormone and cortisol regulation happen during sleep, critical for tissue healing and reducing inflammation in overused vocal folds. REM sleep, restores neurological function and vocal coordination. Deep sleep, N3, vital for tissue repair. 3.2 Sleep deprivation and the voice. Chronic sleep loss can lead to reduced vocal stamina, weakened immune defense, more throat infections, impaired laryngeal nerve signaling, muscle fatigue, and delayed vocal fold closure. 3.3 Circadian rhythms. Voice may sound different depending on the time of day. Vocal warm-up is essential in the early morning. Sleep hygiene practices. Go to bed and wake at the same time. Reduce blue light exposure. Avoid heavy meals before bed. Section 4. Stress, mental health, and vocal tension. Psychological stress can cause unconscious muscular tension in the larynx and surrounding structures, leading to hoarseness, vocal fatigue, muscle tension, dysphonia, MTD. Stress management techniques. Diaphragmatic breathing, meditation and mindfulness, yoga or body alignment practices, Alexander technique, journaling or expressive writing, psychological support or therapy. Section 5. Lifestyle toxins and environmental hazards. 5.1 Smoking in the larynx. Smoking dries, irritates, and inflames the vocal tract. It can lead to chronic hoarseness, Ranke's edema, laryngeal cancer. 5.2 Vaping and e-cigarettes. Although marketed as safer, vaping exposes the larynx to toxic chemicals and heated particles. 5.3 Environmental irritants. Dust, mold, chemical fumes, dry or polluted air, high pollen environments for allergic individuals. 5.4 Allergen control. Use HEPA air filters. Avoid vocal use outdoors during high pollen seasons. Section 6. Developing a vocal wellness lifestyle plan. Key pillars of a sustainable plan. Daily hydration. Begin and end the day with water. Smart nutrition. Prioritize anti-inflammatory, nutrient-rich foods. Adequate sleep. Aim for 7 to 9 hours with consistent routine. Stress reduction. Integrate breathing or relaxation methods. Avoid harmful substances. No smoking. Reduced alcohol and caffeine. Environmental control. Use humidifiers. Avoid polluted areas. Self-awareness. Track vocal fatigue, hydration, sleep, and diet daily.